Yeah. And again, I think that's an interesting point of clarification because you also are a believer that massage is not necessarily the right solution for pain management,
Yep.
right? And for healing. But I think there's some clarification that it feels good.
Oh
And
yeah.
if you're doing it to feel good, that's okay. But if you're doing it for, again, improving overall health and improving an injury, that's not the right technique, is what it sounds like.
Correct. So that would just go back to the point that I just made about if you're going to the point that hurts or feels tight,
Hmm.
that's usually not the problem. So I think we did this with you, like bend over and touch your toes. That feels tight in my hamstrings. That feels tight in my back. I
Sure.
go and work on your abs. You touch your toes the second time, you go further. You have no tightness because the way your body works is one muscle on one side is supposed to be moving you into position. And when it moves you into the business, so when your abs contract to get you to touch your toes, it's telling the muscles in your back and your hamstrings to contract less. So if your abs never contract, nobody tells your back and your hamstrings to stop contracting so much, and they contract more. So that's why you think you have a tight low back or tight hamstrings. And that's where the whole thought process of rub it, massage it, Theragun it, all those things to the spots that are tight. The spots that are tight are telling you we're working way too much because the guy on the other side is not doing what he is supposed to be doing.
Opposites attract, is what you're
Correct.
saying.
Yep.
Yeah. So interesting. Um, for folks maybe who have never really worked out, right? And as they age, you talked about the importance of range of motion and strength and stability and functionality. Is it too late? What would you recommend for someone who is aging, who hasn't worked out, but really understands now in their life? It's just as important, if not more important.
Yep. So here's the keys, especially for older individuals that like this scenario haven't ever worked out before. So we stress some important points when we talk about exercise. So when I talk about functional exercise, there's some things that it has to have in order for me to say that's functional. One is full range of motion. So if I'm just doing a partial range of motion, that's all I'm training. So if I'm an older person and I walk outside on the ice and I start to slip and I get into a range of motion that I haven't been in before, that's where bad things happen.
Hmm.
But if I've trained full range of motion, my body gets in that position again. It's like, oh, I've been here before. I can get myself out.
Hmm.
So one thing that's important, and this is not even putting weight on things. Just use your body weight. Just go through a full range of motion when you're squatting or when you bend over to pick something up. So this is one of my biggest pet peeves with the medical model. And when people go to see their doctors and they say they have a bad back, so then they get an image and they get scared about all this imaging and they have a bad back and they're not supposed to move their back anymore. Well, your back is made up of a whole bunch of joints, and joints are there because they're supposed to move. So the more you move the joints, the more you maintain range of motion, the more you maintain strength, the more you don't get hurt. So it's not, well, my back hurts, so I need to stop moving it. It's my back hurts, so I need to figure out what's not working, and then I need to move my back more. So full range of motion, some kind of weight. So, and that could be body weight. So if you're somebody who's never done exercise before, you're 66 years old and your hips feel tight and your back feels tight, just do body weight, just bending over, picking things up off the ground, do a little sideways walk, twist and turn a little bit, and start using the motion that feels comfortable. And pretty soon you'll feel like your motion is getting bigger and more comfortable. That's your body saying, oh, I'm supposed to be able to do this.
Hmm.
Well, when you do that more, when you get in that bad position when you're slipping on the ice, now you can actually react and save yourself because your body has what's called proprioception, which is its ability to figure out where it's at in space and save itself. If you
Hmm.
never get in that position, only bad things can happen. So if you're going to start exercising, just do body weight. Just do work on as much range of motion as you can. Don't feel like you're forcing it past pain because that's your body telling you, I can't tolerate this. Please stop doing that to me. And just see it as you go through if your range of motion gets bigger and you tolerate doing more things. That is like green flag. You figured out this is actually helping things out. So full range of motion, easy body weight, try to have some type of rotational component because all injury happens because we lack the ability to maintain or control the rotational motion. So the more you can twist and turn and rotate on your own, again, the better you'll be when you get in that bad position. And then I would say the last thing would be try to use as many joints as possible. So we're not doing a bodybuilding workout where you're just doing curls. Try to make whatever you're doing, even if it's no weight, try to move as many body weights at the same time as you can, because that's teaching your body to work with each other, the joints to work with each other.
It's great. I love the visual, although it's scary, the visual of slipping on ice and thinking that you're contorting your body in a way that, you're not used to. And I think that's a great visual to be able to say, if you end up in a bad position, have you ever been in that position, not before, but recently, right? Have you intentionally put yourself in that position? Because I'll go for hikes or runs, on trails and step on a rock wrong and twist. But because I do it regularly, I can get out of it safely, for lack of better terms, right? Makes sense.